Okay, so let's start off our study review and outline with these. These are important phrases that we've already talked about in this class, but we'll bring them back up, like I said, again for the video. Learning is painful. You guys know that already, right? You can't get juniors and seniors in high school and not know that learning is painful. It should be painful. It takes time, it takes effort, right? It involves a number of different things that you have to do. Okay? And this is important because we live in a microwave world now. I do. Google, right? If you want information, you Google it, and it comes up on your phone or your computer or whatever in seconds. Sort of that instant gratification. Well, true learning is not that. It takes time, and over a period of time. I mean, sometimes years. It takes years. Remember your patient assessments that you guys have been doing? I was telling you that when we start, you in the first part of this semester in school, like in October or whatever, that you will finish and you will that end by May. That's the time frame. So October to May to get a basic understanding of patient assessment. So it's over a period of time, but like the statement says, and these are not mine, I got them from a book. Okay? If you have to have that instant gratification, your greatest rewards in learning are that. You just won't have them. It doesn't happen that way. Okay? And the other one is that if we have to think harder, we have to critically think through this process. If not, then we won't be able to come up. The same with the scenario questions that were presented to you. You have to critically think and break those things down and picture where you're at in the scenario, okay, in order to get the right answer. And I've got some example questions up here that we're going to go through, just a couple at the end, okay? But let's start with your study time. This is a big, at your age, especially younger, this is a big shocker to you that in healthcare across the board, study time is measured in like double-digit hours. Okay, we know for this class that we have a 9-hour study expectation per week, and I broke that down a little bit for you, and we'll look at that again. But these things come, like the next slide's going to say, these things come from historical success or multiple data points over 20 years. This is not all my information. A lot of it comes from people who are doctors and nurses now. Some of it comes from Pearson VUE setting in seminars and other people setting in seminars, learning how to take tests, and they pass this information on. But it's still true because the brain hasn't changed really any. Okay, the way that we basically learn hasn't changed. We learn through time and memorization, and then we apply, and then we analyze, and we use more critical thinking skills as we go through. But this will stand forever. You need to study in the same environment that you're testing in. Most people test in a quiet classroom, right? There's not any noise, there's not any music or phones or anything. And we will mention phones several times because it's the number one distractor of everybody that of your age and a lot my age. They don't put their phones down, right? That's a huge problem. The smartphones are great. I love mine. I use it a lot. But when it comes time to study, in your study time, you need to take these distractions away. Also, this does not include group study. What is group study, really? Do you guys study in groups? Anybody study in groups? Good. Because group study is the time that you get with your friends and talk about Friday night and Saturday and the weekend and football or whatever you have going on in your life, okay? Group study is not very productive because you spend too much time talking about other things and you get these distractions and then you have to go back. So you spend 5 minutes studying, if that, and then 10 minutes talking about the football game, right? So it's a little bit different than that. So we have to study in the same environment that you're testing in. Here's a big one for you. I struggle with this too. When I was in school, no food, no drinks, okay? It goes back to the research of when the brain uses stimulus. They get a stimulus. If you want to know some of the research in it, it goes back to the spearmint gum research. We talked about that before. People chew gum, spearmint gum, it creates a stimulus, and they're studying. And what takes place is that when you try to recall the information, not that you forget it, but when you try to recall the information, the brain is looking for that stimulus. It's looking for the spearmint gum. Okay, the same way with food and music and different things, the brain, when it goes to recall, it looks for a stimulus. The same thing with smells and taste and sight. When we smell fresh baked apple pie, what do we think about? You know? Or you see something on television in a stimulus. In healthcare, it's the same way. I smell that fruity odor smell, and I think of ketones, right? And then all that information is sort of recalled about diabetic ketoacidosis. You know, sort of that way in there. Does that make sense? So it looks for this stimulus. So you need to study in an environment that's the same environment that you're testing in order to enhance your recall. The other one, and these are really quick, know all your vocabulary. If you don't know the words, and I have an example on one of the questions at the end, you don't know. In my EMT class, across the board, every one of them didn't know this word, and every one of them couldn't answer the question. So I know it works. I just proved it the other day. One word that can't answer the question because they don't know the vocabulary. You have to know all the vocabulary. In healthcare, you need to know all the signs and symptoms and treatment for that particular disease process. Okay. In history, what do you need to know in history? You're studying history. Dates. You know all the dates. That's the basic thing. You need to know all the dates. You need to, I guess, and maybe you guys still learn capitals, right? You need to know all the capitals, right? And going back on this, in healthcare and history and these different things, you have to have a process, some sort of process where you have a good memory device, where you can remember a lot of facts. That's a must. Okay. Everybody has different ways to do it. In healthcare, you need to know all the pieces and parts. You need to know the anatomy. You won't function well, you won't do well without knowing all the pieces and parts, all the anatomy and physiology, how it works. Okay, the function of the pieces and parts. You have to know that. That's basic knowledge. And without that, you're unable to really answer a lot of the questions. We go back to the next one, the same thing. Eliminate distractions, because these distractions, okay, are not in the same environment that you're testing in. That's why that I try really hard when you guys are testing, not to, like, at the end of the test, you've been in other classes where at the end of the test, everybody gets in their notebooks or they're doing stuff and you have all this other sound that's taking place in the classroom, right? When somebody else is trying to take a test. I've done it, you've sat there, you're trying to recall information, and then somebody opens up a Coke can, or somebody gets back into their Snickers bar and the wrapper, or they're getting in their backpack and they start moving stuff around. And then it's right there. That information is right on the tip, and then that sound comes in, and boom, it's gone. The information's gone. Has that ever happened? Okay, good. I'm not the only one. So that information's gone, and you can't recall it. That's why the environment in a testing is quiet. Okay? And it should be quiet. Should not be any noise or distractions in there. The temperature in the room and the lighting in the room needs to be adequate too. Okay? So all these things take a big part, because what this does is it causes distractions, and distractions causes you not to be able to recall information. Hey, being hungry is a distraction. That's why you should eat before you take a test. When I was in college, almost across the board, because I'm a little superstitious, okay? Before every test, I took 2 Tylenol because I knew I would get a headache during the test. So I eliminated that. Okay? I drank a Dr. Pepper, not diet, one with the 23, 26 flavors, whatever, because it's high in fructose. And then I ate a Snickers bar so I wouldn't get hungry in the middle of the test. Because if I get hungry or whatever in the middle of the test, then it's distraction. Plus, I know that when we're taking exams, we burn a lot of glucose. When that brain's working, we burn a lot of glucose. So I get a little hyperglycemic before I go in and take the test. That way, when I burn a lot of glucose, it just brings me back down to a normal level, in theory. Okay, I never took a D-stick in the middle of an exam. Okay, that would be a good experiment. So it eliminates these distractions. The same way with your chair. You know, a lot of me, including me, study in our lazy boy or whatever on the couch or in the bed. Okay, you take the test in the hard chair, right, and then a comfortable one. Well, what takes place is that if you get used to that, then that's one less distraction. If you take a long test, let's say it's going to take you an hour or so to take, your butt goes numb, and you're trying to shift and move, right, to get some blood flow. And all that, is a distraction. So you want to get used to that to eliminate those distractions. There's pages and pages of research out there on the phone. That's why we have you put your phone away. That thing it blocks the way that we receive and what's the word? Use information, how we receive it and understand information. It blocks it. It causes a bottleneck. That's the words that the researcher uses. From Baylor. It causes a bottleneck of information, and we lose that information. Okay. The biggest one is when you get these distractions out of the way, you have to put the time in. And I threw up some times. The time that I've required my EMT students to study for the National Registry, one exam, is 19 hours of study time. That's circumstantial study time. That's what they study for that exam. I want them a minimum of 19 hours, and that's only if they have done their 9 hours per week of non-circumstantial study time. If they haven't done their 9 hours per week of non-circumstantial study time, that to study, right? Then they have more. They add to that 19. They can settle in about 19 if they've done their non-circumstantial study time. For the MCAT, for you guys who want to be doctors, the test that gets you into medical school, months. For the NCLEX, for the nurses, that certification license exam for nurses, probably in a month. you take review courses and you study in a long period of time for that. It's 2 years worth of information. Okay? So once you get into medical school, then you have other exams that you have to take, to continue on, and you will study a lot for those exams. Researchers across the board have said that to have comprehension of material, you have to read it 3 times. So you have to read the chapter 3 times to have good comprehension. In here, since you guys don't have books necessarily, you read your notes. Those notes that you did over the videos and stuff, then you would read and highlight those notes a minimum of 3 times. Okay, before that, the first time that you read, it's just reading like you read a novel, you read through it. The second time that you read and highlight and sort out your notes. And the third reading is you read through and you read your highlighting, you pay particular attention to that, and take notes on still knowledge gaps that you may have. But three readings, okay? It's very important. The other thing in healthcare is to stay within your scope of practice when you're studying. Don't study stuff outside of your scope of practice. So you guys wouldn't study things, that a surgeon would do, hypothetically. Okay? So stay within that scope and stay within bookland. In EMT, in nursing, whatever, you're confined to a book. So you have your textbook there, and you have to stay within the scope of practice within that textbook. You don't want to get outside of that scope of practice. Does that make sense? Because real world medicine is a little different than the book sometimes. And we start applying real world medicine to an exam, and the exam is based on the textbook. So we have to stay in textbook land while we're taking exams, not real world medicine that you might see. Okay. Any questions there? Some of that's a review for you, right? Okay. So some test taking, and these are repetitive because they're important. Always study in the same environment. We just talked about that. No distractions, no noise, the phones. Put all these things that would distract you in another room. So take your cell phone, turn it off. Take your iPad, take your computer, take your Apple Watch, your dog, your cat, your siblings. Everything goes away. And you're in this nice, quiet environment in your upright chair, and you're studying. And what's the word? Come to me in a minute. Okay? No food or drink while you're studying. Eat and drink on your break. Okay? You're seeing the template that I have here. Again, you need to eat, and you need to get some water in you, and you need to do these things, but do that on your break when you're studying, in between your study times. Okay? That's really important. You don't want those stimuluses going. Once you start, when somebody reads at night, anybody read at night? You fall asleep reading at night? Do you read during the day? What do you do when you read during the day?
Just read.
Do you fall asleep?
No.
Oh, that's good. Because most people fall asleep because they read at night and they fall asleep. The brain, when you start reading, the brain goes, oh, it's time to go to sleep. And you go to sleep. Okay? So that is sort of plays a part in there. But eating and drinking is the same way. You're used to snacking on the chips or having a soda or something during your study time. And when you sit down in your test, the first thing that your brain wants to do is to get a drink of water, get something to eat, get something to snack on. Okay? Music's the same way. It's that stimulus that the body is used to. They've done experiments on this. I've done sort of little experiments on this. I had students that were used to listening to music while they studied, okay? And then for a short time, I allowed them to listen to music while they were taking the test, okay? And they seemed to recall information better. When I took the stimulus away, not that they did bad or poor, but they had a harder time recalling the information because the brain was looking for that stimulus. Same way, sit upright in a chair that's not comfortable because you sit in a chair that's not comfortable, not on your bed or your recliner, because also you have the tendency that you fall asleep. Dude, you get too comfortable, right? With that. In Karina's videos that we watched at the beginning of the year, it's on the YouTube channel under the playlist, just a plug in for that. She did a great job, 2 separate videos, that because she took a course at the University of Texas over studying and learning. And it was a psychology course. She's in medical school right now, just to give that some validity. All right, she's done what she needed to do to get in medical school. Probably maybe her 3rd year by now. I think that's a guess. But in her video, she's telling you to rehearse. That's the words that she uses, or teach. She used to teach her cat. So she'd learn information in class. She'd go home to Kitty and reteach out loud, which is one of those. Oh yeah, do what you can out loud for better comprehension. She did it out loud to increase the comprehension of the knowledge. Okay? So your stuffed animal, your siblings or your parents get too distracted, but poor Kitty, she's sitting there. If cats could talk, right? So reteach the information. That is a really good way to understand and recall. How do you think this old mind that I have is able to recall this information? Right? I teach it 3 or 4 times each year. Okay? I'm sort of constantly recalling and reteaching this information. But that's important to you. I'm sort of a pacer. I might walk back and forth. I get that this is sort of outside what I just said about study in the same environment, but it does help. It's sort of a, when you get tired of sitting in that hard chair, then you go off and reteach and redo that. A different part of studying. I get it that there's multiple layers and multiple ways to do it, and this is just a different part. Again, repetitive. You've got to put in the time in studying. 9 hours non-circumstantial study time per week. And as you'll see in a minute, that's per class. This is per class. So that time adds up. Okay? And then, I'm not this organized to do it, but keep track of your study time. A study journal is super as far as you being able to track your study time and track what you're doing. It's really good. It's gold. It'll help you in time management. College and school and your work is basically good time management. Most people get through college because they have good time management, and they know how to study, depending on what your major is. If you're an education major, then you can get by on good time management because it's such a boring, it's like watching paint dry. Okay? Anyhow, those are techniques that has historical success, meaning over a 20-year period or so. Very important to lock onto that that you're studying in the same environment, and work on that. And then probably if you had to put those in order, I would say the time in, because if you're not studying in the same environment, or your group studying or something like that, you can't count that towards your 9 hours. This 9 hours per week is proper studying. Okay? Some techniques in test taking. When you answer the question, forget it. Most of the time in college and beyond, you guys are taking tests over, like on Blackboard or something of that nature, where it won't allow you to go back. All your certification exams won't allow you to go back and look at the question. So when you answer the question, forget the question. You can't do anything about it. Right? If you dwell on that question, it only becomes a distraction. And I know that I've done it, you guys have done it, right? You're answering questions and you think that you're getting the question wrong, okay? And you answer another question, you think you got it wrong, and all of a sudden now you're distracted on answering questions because of your grade. You're thinking about your grade more than you are the question, right? Because you think that you're getting these incorrect. That's why you have to eliminate that distractor. You go in there and you answer the question and you forget it, and you also, whether you have it right or wrong on the question, you think up here, I got that one. That's super important. A lot of testing is a mental game, okay? And you've got to sit down there and you answer that question, whatever you put down, and you learn in your mind that I got that right. And then you move on. Okay, that's why you're not thinking about your score. Same way in the great game of golf, right? Good golfers never keep track of their score till the sort of the end. Okay, like the last few holes of a golf tournament. They don't keep track of that. They stay positive during it. Just like it says here, you can mess up your tee shot because the ball is already gone. When I stand on that tee box and I hit a bad shot, it's gone. I can't do anything about it. It's down that way, right? What I have to do is recover, forget that shot. Good golfers have short memories. I forget that shot and I concentrate on not messing up the second one. Does that make sense? You have a bunch of different shots. You have a bunch of questions that you have. Don't worry about one question, one shot. Okay? Just don't mess up the second one. And the way that you do that is you forget that question. You put it out of your mind. You think that you got it. Again, the great golfers, which I'm not one of them, okay, really, but they have short memories, and also they stay super positive. Most all of them have a coach that they work on staying positive. You can't be a negative person and play golf very well. You have to stay positive. And that goes along a lot of the sports, you know, but golf is one that you have to stay in your mind. You have to stay super, super positive. I mean, they go to these sports psychologists to help them combat negative thoughts. The same way with test taking. You can't get all negative in the middle of a test because it creates a distraction. Right? If I'm all bent about chunking a ball or hitting a ball in the leg or something, right? Bad golf shot, it's going to cost me, but I'm not going to mess up the second one. I'm going to forget that, move on. Okay? If you get to a question, you have absolutely no idea what the information is, you don't know, use good test-taking techniques that we're going to talk about, and then do the best you can. Okay? All right. This is just a template that I came up with. I found it the other day. I'm like, oh, this is nice. Where did this come from? I didn't make it up. So either Mary or Karina made it up. Who knows? But somebody made it up. Maybe Marissa made it up. I don't know. But this changes as your subjects change. More time needed for circumstantial study time for exams. When your non-circumstantial study time is studying just to study. Your tests are circumstantial. So you have to understand that it's going to take more time when you have an exam. This is non-circumstantial study time. You can put anything in there in these blanks that you want, okay, on the subject line. But I just sort of, not me, but whoever came up with this sort of had these in here. I did the 1.5 because of the fact that I did the math for your 9 hours, okay? And these blanks are handy because the fact that you can write down what time that you studied to. Put that time down in there. And at the end, make sure that that time equals 1.5 hours if you're shooting for that 9 hours. I even put down, the total process is going to take you 1 hour and 45 minutes because you need breaks in between. So you need those breaks. So you're looking at, to get the 9 hours per week, and you'll notice on the next slide, I gave a day off, okay, to get your 9 hours in. So it's going to take you about 1 hour and 45 minutes a day. It's up to you where you stick that 1 hour and 45 minutes in, right? And also what you have to eliminate in your life to get that 1 hour and 45 minutes in. One class, keep that in mind, okay? Take a 5-minute break, but write down those classes. So I just put in here, hypothetically, on Monday, I'm going to review cardiac, CPR A&D, some physiology, how the heart works, how this works, and I'm going to read. That's going to take you some time. You need to add that in there, that you're going to read and reread, maybe, right? And then the same thing on Tuesday, study my oxygen, my medications, vocabulary. I'm going to read. I'm going to put these times in here that I'm studying. One, it's going to hold yourself accountable to your time. All right, so if you have 1 hour here, 1 hour here, and you go back over the time in the week and you look at this, then you're going to realize, oh, I don't have the right time in there. I don't have enough time in studying. You take a test and you so happen not to do so well in the exam, then you come back to your study journal or this template and you look and say, okay, well, that's why, right? If you have a 100-question exam and you spend 30 minutes studying for that exam, there's no doubt why you did poorly, okay? Some people don't need this much. Most people do, okay? And as the information gets harder and harder, then you're going to need more information, more time to recall information. Okay? And then it goes on. I'll post this electronically so you guys have it if you want it. Wednesday, you're going to study body systems, how the renal system works, how the digestive system works, respiratory airway shock, and then I'm going to read. These alone, you can easily spend 1.5 hours reviewing and studying these properly. If you do it properly, then you maximize this time that you're studying, okay? And then Thursday, Friday, you get that Medterm. Maybe you have a Quizlet that you want to review. You study pathophysiology, the way things work. You read Friday's a little different. It's an extra study day. Use this day to review topics that you don't understand or you need help with. That's good to have that day. I'm just not understanding that Krebs cycle. Okay? I'm not understanding, actin and myosin when we get in cardiac physiology. So you would use those. I think Con is a very good series of videos. He explains things to where I can even understand them, or some other good YouTube videos that give you good explanation. And then maybe you need this Friday to catch up on your reading. Okay? Saturday, study the new information that you're going to learn the week before. We try to do this. We flip the classroom where you guys watch the videos and then you take your notes and then you come to class and you're prepared for that, okay? This is important. New information. Okay? If you had a textbook, it'd be easy because you look at your syllabus and you go, okay, next week we're going to do chapter 20 and 21, right? So you would read that and you would study that information and you would be aware of it. Maybe there's a video out on the top. I can guarantee you there's a video out there on the topic. So let's say you're going over, the Krebs cycle next week. You might watch that Con video over the Krebs cycle. That way, when you sit in the classroom, it's not your first time hearing about it. And then Sunday, there's a comma, rest. You need rest. You need some rest there if your work's done. If your work's not done, then we don't get rest. I do the same thing. I try to get absolutely everything that I have to do done before Sunday. My laundry, yes, I do my own laundry. Cleaning the yard. Whatever it is, whatever task that I have to do, I try to get everything done before Sunday. One, that's when the final round is golf matches on. Okay, but two, I need to rest before the upcoming week. Your rest is super important. Okay? Good, like it says, good time management rewards you with the rest that you need. Now this is the bad news. This template's for one class. When you guys go to college and you take 4 classes to equal your 12 hours, full-time college student, each class is 3 semester hours. Take 4 of them to get 12, right? That's a full-time load. Then you multiply this times 4. Now you understand. Now you sort of get that that's going to be a lot of time management. What's 4 times 9? 36? Really? Okay, good. 36 hours of non-circumstantial study time per week in college. Now I'm not saying this for the C. Okay? If you want the C, then you don't have to do this. This is to get the A. To be A and the sprinkling of B's. Okay, that's what this is for. All right, these definitely review for you guys. This is for the National Registry exam and also for any multiple choice scenario-based exam or really any multiple choice exam. You have to slow down. You have to read the question. Take 45 to 60 seconds for each question. The time that you are allowed for a test question is 60 seconds in scenario-based questions. Sometimes a little shorter if it's just anatomy and physiology, okay? But all scenario-based questions, you're allowed 60 seconds. Read the entire question, every word of the question, okay? The number one reason people miss test questions is they don't read the question. They skip, they scan. Pearson and View told me when I went to one of their seminars that people who read on the computer, and the older you are, the worse it is, read on the computer, they scan. Old people, if they want to read something for comprehension that was on the computer, what do? They print it and they read it on paper, because it's a habit, and all your exams are on the computer. It's a habit that they found out that people, when they're reading on a device or computer, they scan and they don't read each word. I'll show you in the questions here in just a couple minutes. Determine what the question's asking you. You have to know what they're asking you. You have to put yourself in the scenario, and you have to understand what the question's asking you. You don't want to add or subtract to the question. You want to understand what they're asking you. In this particular case, what type of emergency or what type of healthcare issue is taking place? If it's a cardiac question, the answer is going to be cardiac. It's not going to be a cardiac question and have a respiratory answer. It is always, if the emergency taking place is cardiac, the answer is going to be cardiac. Okay? But you have to do this. This is why it takes 60 seconds to do each question, or 45 seconds. Read all 4 responses before you make your mind up. Go down there and read the responses. And then pick the best response that answers 3 and 4. What are they asking, and what emergency? All 4 may be correct. So what happens is that you have to pick now the best correct answer. You can depend on that in nursing and medicine across the board. It doesn't matter. This is a step process that you have to get used to. Again, we go back to the great game of golf. These good golfers, they have a pre-shot routine that they do. They stand behind the ball, they close their eyes sometimes, and they envision their swing and the flight of the ball and where the balls don't go. They envision the entire shot before they get up to the ball and they hit the ball. Sort of a pre-shot routine. This is a pre-question routine that you need to have. You need to do this on every question. It goes by quick once you get used to doing it. This is just the other day, like yesterday, I think it was. One of my EMT students told me this. She overthought the question and she changed her mind on the questions. Like half the questions that she missed, she went back and changed her mind on it because it was a paper test. Electronic wouldn't be able to do that. Your first thought is usually correct. So when you do this process, your first thought is usually the correct answer. Don't overthink or don't go back and start changing your answers if you can, right? We've already talked about this, but like I said, it's repetitive because it's important. Submit that question and forget it. You can't do anything about it. Don't overthink the question, meaning that they have a question where they want you to open the patient's airway and you're thinking about doing a needle, surgical airway or something. You're overthinking. They just want you to do a head tilt chin lift and you're thinking about doing a surgical airway. Right? Doesn't make any sense. So make sure that you don't overanalyze and overthink about. I had a student the other day who started thinking about the Krebs cycle, and all they wanted was the patient was hypoglycemic, right? That's all the question was saying, that the patient was hypoglycemic. So thinking about all this stuff involved in the Krebs cycle, way overthought the question. Okay? And then try to put yourself in the scenario. Where are they at? What have they done? Have they done their ABCs? Have they done vital signs? Did it tell you in the question whether they've done vital signs, right? So picture yourself where you are in the question, in the scenario question, and then pick up from there. Does that make sense? When you read those scenario questions, you have to sort of put yourself in there. And then these, if this number one's super important, if any part of the answer choice is incorrect, the whole thing is incorrect. The whole answer choice is incorrect. Okay? That is basic test making 101. If it asks you to do an intervention that is not part of your curriculum, whether it's EMT or PCT or nursing, that is incorrect. If it's outside of your scope of practice, it's incorrect. In the EMT land, if they ask you to not transport the patient, it's incorrect. You will always do treatment. Or any other medical-based question, if they're asking you not to do treatment, then it's incorrect. Now, monitor, observe, or this is a normal, the scenario is giving you a normal, the patient that's breathing 16 times a minute, his SpO2 is 100%, he's warm, pink, and dry, what would you do? You know, that's normal, so there's nothing to do. Okay, that's different. This is not with you guys, but you would follow your patient assessment skill model. Well, you do have that. You have that patient assessment flow chart. So you would follow that flow chart or your patient assessment medical trauma on what to do next. Because a lot of the question is, what do you do next? Well, you follow that flow chart. That's how you have to put yourself in the scenario. And you have to do the appropriate treatment. If it seems appropriate, if the answers seem appropriate, then what addresses the situation, like we talked about, it's OB. It's an OB emergency. It's not a respiratory emergency. So you have to determine what type of emergency it is. So these are just really good test-taking rules. The person who made up both of these, she's a board-certified pediatrician now, and she's in. You hear me talk about Mary every once in a while. She's in a neonatology fellowship. She's going to be a neonatologist. So to give that some validity to it, she also went to all those classes that before she even made this to prepare for the MCAT. So these things here are sort of coming off of that, off of these test preparation classes. Okay, last couple things. We're almost done. These are all dealing with OB patients. Just read that scenario to yourself. If we're a little ahead of this, but this is why I'm saying that we have to read the entire scenario. We have to read the entire question first, because one sentence in here makes that where it is not correct. So a pale diaphoretic young lady weakly tells you that prior to passing out, she remembers becoming lightheaded with pain to her right lower abdomen. She now has diffuse pain, which is all over, that radiates into her left shoulder. Her last menstrual period was 7 weeks ago. So she's probably pregnant, right? She is unsure if she's pregnant because she has irregular periods. She denies vaginal bleeding, blood pressure low, 74/48, 132/26, and non-labored. What condition is most likely happening? Okay, that's a lot of stuff, right? You're sitting there like, ugh. Got to sort of sort that out. Okay? Most everything in there is a distraction. They're famous for putting distractions in multiple choice questions. She's more than likely pregnant because her menstrual cycle was 7 weeks ago. Okay? This is a distraction. That whole sentence here is a distraction. This diaphoretic weekly tells you it's passing out. That's another distraction. Okay? The vital signs tell you that she's probably a little hypovolemic. Okay? So she's in shock. She's in hemorrhagic shock. Let's say that we can pick that up from the test question. I'm not even sure what this A is. Okay? Abrupto placenta, which you guys haven't been, is over a trauma. So it's a traumatic event that takes place. So we can rule these two things out really quick. So she's either having a spontaneous abortion, which is a miscarriage, or a ruptured ectopic pregnancy. An ectopic pregnancy, all you guys, females, should know what an ectopic pregnancy is, right? Everybody shake your head. If you don't know what an ectopic pregnancy is, you need to go home and talk to mom or wait till we do our OB lecture, okay? That's important. Everybody should know that. Female. So we're going to limit this down to spontaneous abortion or miscarriage or ruptured ectopic pregnancy. What in this scenario makes it a ruptured ectopic pregnancy? And you may or may not know this because we haven't got there yet, but what makes it a ruptured ectopic pregnancy? One sentence in the scenario.
She denies bleeding.
Very good. She denies bleeding. Because in a miscarriage, mom has bleeding, right?
Yeah.
Okay. That's what makes this here. One sentence in that whole paragraph makes it that. I'm sure that is something, but I'm not sure what it is. A. I know that it's not it because it's trauma. This, she's not bleeding. It has to be this. Right? Does everybody see that in there? Okay. After being struck by a car, a 3-year-old child with an open femur fracture is unresponsive to voice or pain. Respirations are 10, irregular. What should you do? Okay? So now we go back to our flow chart. What is one of the first things that you do in patient assessment?
Vital signs.
No, vital signs are down the road some. What is one of the first things that you want to make sure that your patient has?
A pulse.
A pulse, but what else? Airway. Exactly. They want to make ABCs, right? That's what this question is about. You may look at this. Now, we haven't done pediatrics, but 10, even for adults, is slow, right? All this is a distraction. This 3-year-old child, open femur fracture, unresponsive they're trying to bait you here, okay? Because what we want to do when we look at this, and if we don't read the whole thing and determine what it's asking us to do first, because we don't know if the patient has an open airway. But when we look at this irregular respirations, they threw in this airway thing, this respiratory thing. At 10, our minds want to instantly go to bagging the patient. Now, we would get there really quick. This patient does need to be bagged, okay? They need positive pressure ventilation. But that's not what we would do first. What we do first is make sure to open the airway, protect the C-spine because it's trauma. Okay? But we'd open the airway. We wouldn't do vital signs. That's vital signs. It doesn't matter if they have a low blood pressure or not if they can't breathe, right? Okay. And we wouldn't apply oxygen if we're talking about oxygen, we would ventilate the patient. But what this is asking you here, what you should do first, you should open the airway. So this is not a trauma question. What type of question is it? Airway question. Right, exactly. It's an airway question. So we determine that. So we can, it's an airway question, we can eliminate vital signs. Okay? We have to go from bag valve mask. Well, this is oxygen, this is airway, but this is airway, right? And so, well, we can't bag them unless we know they have an open airway. So you go back to your ABCs. Okay? Make sense? Make sense on the question? All right, last one. Oh, no, two more. Sorry. An infant who's 28 weeks, an infant, that's a typo. Well, an infant in just 28 weeks gestation, so mom's 28 weeks, the normal's 39, right? So we're early, premature. She's crowning, means she's about to have a baby. In the cephalic position, you most likely need to, now again, unless you guys know about OB, you wouldn't know this, because we're a little ahead of that. But where everybody got this question incorrect when they started looking at it, they didn't know what cephalic meant. Who can tell me what cephalic means? You guys know this.
Is it like head first?
Head. Right. Head. Cephalic means head. Well, in a normal delivery, okay, the baby comes out head first. But without knowing this, they don't know. They don't know what to do because they're not sure what cephalic is. Cephalic position, or the head first. So this baby is premature. They're coming out normal. They're coming out head first. All right? But to give you the answer, you don't panic. Okay? The baby's not support them. This is...
The baby isn't dead yet. It's not even...
That's right. The baby's not dead yet. We don't know this. This is adding to the question. They very well could be at 28 weeks, but we don't know this. So that's adding to the question. That's good. So we don't know that. We don't know if the mom is hemorrhaging, right? We don't know that yet. So 28 weeks, their lungs are not developed, so we're going to have to assist respiration. Does that help you breaking that question down a little bit? When you start looking at that and seeing how to sort of to break those down, we read the entire question, we read all four responses, then we start eliminating, and we eliminate the distractions. Okay, this is definitely the last one. You are assessing a supine 39-week pregnant patient who spilled hot grease on the top of her feet. She begins to complain of nausea and weakness. You should first. All this is a distraction. The whole thing is a distraction. This is an airway question.
Just don't listen.
Right? Because why? Why do we want to, what do we need to do first?
Check airway.
That's not one of the choices. Why B?
She's not supposed to be sick. She's about to throw up.
There you go. Yeah, you're right. She's nauseated. What do we do when we're nauseated? Throw up. Why are they rolling on her side? Right, so she doesn't choke. Just put her in a recovery position so she doesn't choke until we can get our suction ready. See, this is an airway question. When I first read that, I'm like, wow, that's weird. You know, the hot grease, that's trauma. That's a burn. None of that figures in. 39 week, I know it's an OB thing, but that really doesn't figure in. I don't need pulse oximetry right now because there's no indication here, right? blood glucose level, if there's no indication of her having an altered mental status, pain vital signs, we know that's sort of pretty low. But being an airway question, we know to roll her on her side. I had to take a double take at this question when I looked at it. Why? Why do you think I had to double take it?
Because there was so many distracted.
Yeah, and I didn't read the question. I didn't read all the questions. You're right, I did scan it. I scanned it, and I scanned over nausea. Once I reread it, and I went, oh, she's nauseated. She's about to throw up. Boom. B, I'm going to roll her on her side. So she doesn't protect her from aspiration. Does that help?
Yeah.
I mean, that's a lot of information. This took a lot longer than I thought. But it's a lot of information, but you put the time in, and let me tell you, once you get a system down, like any routine, it becomes easier and easier for you to do. I know that 9 hours per week sounds like a lot of time, but when you guys get to the next level, it's not going to be a lot of time. You'll be wishing you could study 9 hours per week for some of the classes that you guys are going to have to take. It's not a discouragement. It's only an encouragement to tell you that, hey, you're going to have to step that game up. You don't have to change the way that you think about time and the way that you think about study time. Okay. Questions? Anybody? Okay.